as we begin to understand more about the connection between our diet, our gut bacteria, and our health, new opportunities for healthcare are opening up. And one of the most exciting and tangible and actionable opportunities in recent times is this relatively new concept we call chronic low-grade metabolic endotoxemia. Now, low-grade metabolic endotoxemia is a phenomena by which low levels of circulating endotoxin above what is physiologically normal in our circulation can alter our metabolism and give rise to dysfunction that gives rise to disease. So these circulating endotoxins are able to interfere with insulin signaling, activate inflammatory responses within the body, and increase oxidative stress above what is considered a healthy threshold. Now, the interesting thing about chronic low-grade metabolic endotoxemia is that we know one of the most potent modifiable factors that give rise to it has to do with nutrition. Now, this review explores the state of the science of what dietary and nutritional factors and even nutritional supplements like probiotics, prebiotics, and others can do to help reduce circulating endotoxin. And what I found is that quite clearly the literature shows that certain dietary factors and nutritional interventions can very significantly lower circulating endotoxin, but not only that, they can improve the dysmetabolism that occurs with metabolic endotoxemia, including insulin sensitivity, cardiovascular risk markers, improving oxidative stress and reducing inflammation. And there is even some great empirical evidence to show that certainly this can have an impact on clinical symptoms and, potentially across a really wide range of diverse and seemingly disparate diseases. Now, this whole concept is really interesting for two reasons. It changes our view not only of nutrition, but it also changes our view of healthcare as well. It changes our view of nutrition in that what we're really talking about here are ways of manipulating our gut bacteria. So we're talking about dietary and nutritional interventions that don't necessarily influence human health per se in the traditional sense where we were concerned for many years of how nutrition influences human metabolism. Here we're talking about how nutrition influences our resident gut bacteria. So that's a different view of nutrition. It's a different view of health in that what we're really talking about here is a way of understanding health that is more based with function and the origins of disease than it is concerned with any particular illness per se, because the concept of metabolic endotoxemia crosses many boundaries in, across our physiological systems. So this, interestingly, is a view that has a strong foundation in the emerging concepts of systems biology and functional medicine that are, forms of science and ways of looking at healthcare and clinical medicine that are more concerned with understanding what's going on in an individual, what is disordered in their metabolism and function that could be giving rise to clinical symptoms, and therefore the emergence of clinical definable disease over time. So what we really have here is an opportunity for understanding the health of an individual and applying these nutritional interventions in a personalized way that can help improve the ecology of the gut bacteria and reduce the endotoxin load in the body, reduce circulating endotoxin, and even enhance endotoxin elimination as a way of improving metabolism, reducing clinical symptoms, and improving people's health over time.